Okay, I wanted to do a video on burning mouth syndrome, mainly for my benefit and also for the benefit of anyone out there that might be suffering from this. In every medical specialty, there is usually something that we really don't enjoy seeing, and it's mainly because we don't have a good way of treating it. And it's a disease that usually patients find very distressing, and it's something that we see commonly enough that we wish that we had a good treatment for it. And unfortunately, there are certain things that we just don't have a good treatment for. And in ENT, this is one of those things. It's called burning mouth syndrome, also called glossidynia or burning tongue syndrome. And so this is a paper. It's actually written by one of my partners, Dr. Jared Inman here at Loma Linda. And he and a couple of our residents did a systematic review on this topic. And so burning mouth syndrome is a chronic oral pain syndrome that primarily affects perimenopausal women. So it's more common in women of a certain age. And it's characterized by oral mucosal burning and may be associated with dysgeusia, so altered taste, paresthesia. This is altered sensation, burning, tingling in the presence of some other stimuli. And dysesthesia, which is the same feelings but without any stimuli. And xerostomia, which is dry mouth. Etiology of process unknown. So we don't know what causes burning mouth syndrome, and that's one of the major things. If you don't know what it is, then you don't know how to treat it. It's thought to be neuropathic in pain. So this means it's just altered nerve sensations. The nerves are just firing off sensations to the brain, and the brain interprets it as burning. The goal of the systematic review. So systematic review is basically a study where you look at all the previous other studies and systematically look at it and try to figure out if there is an overall conclusion that you can come to by aggregating all the previous studies in the literature. So it's a systematic review that is done well can give you a good idea of what the sense of the current literature and the current state of scientific knowledge about a problem is. So they looked at all this. They found 22 randomized controlled trials, and the studies examined treatments such as alpha lipoic acid, clonazepam, psychotherapy, capsaicin. Um, and there were some other treatments like vitamins, benzodiazepine, bupivacaine, catuama. This is a herb, olive oil, trazodone, urea, so a bunch of other things. And basically, the gist of this is that there wasn't anything that really shot out as being very effective. There was one paper on this herb and bupivacaine, which was significant, but one paper generally is not sufficient to say that that is a treatment that works. It usually needs to be repeated because there was one treatment that said that alpha lipoic acid works great, and there's another one that said it didn't, and gabapentin, same thing. So different papers came up with different results, which means that generally, if something is real, multiple people can do the same study and come up with the same results. And if that isn't the case, then it's difficult to say that that something works. And this is another uh, way of looking at the state of literature. The Cochrane reviews do a kind of review of the state of any randomized controlled trials about a disease. They're a very good resource, and they did the same thing. So they found 23 randomized controlled trials, and they looked at antidepressants, antipsychotics, anticonvulsants, benzodiazepines, cholinergics, dietary supplements, electromagnetic radiation, physical barrier, psychological therapies, topical treatments. So they found that out of those, only one of them was a good study. Four of them, they couldn't tell how good the study was because the risk of bias was unclear. And most of the studies had a lot of problems with selection bias and other methodology, problems with their methodology that made the studies not that great at interpreting whether it was effective or not. And basically, when you come down to the conclusion, given burning mouth syndrome's potentially disabling nature, the need to identify effective modes of treatment for sufferers is vital. Due to the limit of number of clinical trials at low risk of bias, there's insufficient evidence to support or refute the use of any of these interventions. So their conclusion was is that none of the things that were tried seemed to be really a great treatment. However, people that are suffering from this, it really bothers them a lot. And so now, if you want, these are the things that have been tried, and they are capsaicin, which is basically the active ingredient in hot peppers. This is often used as a cream for chronic pain on the skin. Benzodiazepines, topical benzodiazepine, that's clonazepam. that was listed over in this paper, clonazepam, and several other things. The herb. So these are the things that can be tried. And alpha lipoic acid is a kind of a supplement that you can buy over the counter. So whenever I see a patient, we kind of systematically try some of these. Sometimes it works, sometimes it doesn't. It's probably in the cases of these kinds of diseases, my impression of what's going on is it may be that these things are not one thing, that it may be several different things that cause similar symptoms, and we're lumping it together as one entity, and it's really not one cause, so like one treatment doesn't work. And a lot of these symptoms have a large psychosocial component. They have a high incidence of people with depression and anxiety disorder along with this. It's hard to say if the depression was caused by the problem or the people who are depressed are predisposed to having these problems, but there's a lot of things that are linked together with these types of problems. And so it may be that these disease processes are multifactorial. There's not just one thing that's wrong. Like if you have an infection, there's one thing that's wrong. You have an infection, and that's what you've got. And then antibiotic would treat that. But these kinds of problems, it's probably a little bit of this and a little bit of that, and there's a lot of a psychological component to it. And so we just need to systematically go through the different treatments, get counseling, and hopefully work together to have a therapeutic relationship with your doctor to try to work through this, and hopefully find a solution for each patient, which may be different than the solution for another patient. And unfortunately, the reason we don't like these is sometimes we cannot find a solution after trying everything we can. So hopefully this was useful to someone. I mainly did this so I could kind of review the literature myself, because this is a kind of a distressing problem both for the physician and the patient.